When we have to hospitalize a child with asthma, we take that as a failure in medical care.
Housing is really the platform to push health forward. We can't do it alone. Health is important, housing is important, but putting those two together is a dynamic that can really push forth the health agenda.
The home is their refuge. It's the place where they need to be safe and healthy. And so whatever we can do in that regard is what matters the most.
I think the promise of health philanthropy in part is to be concerned about health before care, and that's primary prevention work. And so when we think about prevention in the inner city, in the urban community, we think about problems in the environment that are substandard.
Too many people, particularly kids, live in housing that is unhealthy.
When our community is not physically healthy, we're not really doing our jobs as pastors. To remind them of this calling is our goal.
Addressing healthy homes is going to save money to the system, it's going to improve the health of the residents in the community, and it's going to maximize the benefits and the economic futures for all these families.
The Healthy Homes Advisory Council of Greater Cleveland is a collection of well over 70 agencies who collaborate to improve the quality of life in Cleveland and also to reduce the health care costs that exist within Greater Cleveland.
When we look at the numbers of substandard housing in the United States, we've done some research that shows that there's probably 26 million substandard housing units in the United States. Well, that can mean that there are a lot of homes out there that have lead-based paint, got lead dust in the yards, got mold problems, moisture problems, on and on. And so to deal with those houses, we need to find ways to ameliorate the conditions.
Things in the Cleveland area that are making people ill in their homes are many, and it takes a detailed examination of their home to sort out exactly what the concerns are, usually done in the context of what their health concerns are also. But a listing of things would include dust, clutter, combustible gases coming off of a cooking stove, water intrusion and mold growth, whether it's visible or not. And of course, we're always concerned about the lead dust that comes particularly from windows in older homes that have had lead painting in the windowsill.
We began to learn over time that the house is really a system, and what you do at one point or another affects something else. And transport of pollutants is a major problem, and how we deal with the house as a system can affect that.
The house is an important part of what makes a healthy community. And of course, we've all heard that place matters, and certainly the house within that place is an important part. The relationship between health and housing is profound, and there's been many smart people that have talked about that relationship, and that the health of the house really impacts the health of the occupants. And so by improving housing, making it affordable, safe, healthy, and green, we can hopefully improve the health outcome of those folks living in the house.
If you have a rather severe course of asthma as a young child, that affects your lungs for the rest of your life and can be a predisposing factor for producing chronic lung disease when you're an elderly person.
Well, my son, he's had asthma since he was like 6 months old. He was diagnosed at 6 months. So from the time he was 6 months to say 17, he would sometimes have to go to the hospital, or we would need a emergency inhaler, things like that. So it went on for a while. And I just think that since we've got these improvements to my home, that he's not having as many issues as he was having before. I'm a working mom and I don't make a lot of money. So when they came in and put the installation in and did the different things to the outside, the inside, that helped me So I'm able to help my home.
In the short term, what we're really looking for is to improve housing and improve health outcomes. And many of our clients will report that their kids are no longer missing as many days at school. They don't have to take off work. They can make sure that they go to their job and make money, and their kids can get all the education that they need.
Many people don't think about it until they have a health problem. So that makes it more difficult to get a systemic change going, because you spend so much time dealing with individual cases that it's hard to get a systemic change. So I'd say the biggest challenge to healthy housing is raising the level of consciousness so that people are aware of how important it is for everybody, whether you are personally now at this time experiencing a health condition related to it.
So the one-touch approach is central to our work. If you're a family out there and you're trying to address these problems in your home, if you can create one place where you can go to get your services, a range of services in your home that are then derived from many different funding sources, that makes your life easier. It makes it more likely that the work will get done. It makes it more likely that you'll have the maximum benefit on your family.
We have one assessment, we have one inspection, we have one specification, one contractor, and we do everything at the same time. It works out better for the client, the whole family benefits, and we can do more at a lower cost. The Cuyahoga County Healthy Homes Initiative partners with the existing weatherization programs to really provide that integrated, comprehensive approach to asthma trigger reduction and injury prevention in the home. We're looking at health, looking at housing. Hopefully housing will then look at health. So it's about this cross-training, this cross-pollination to really make this project go forward.
The CASE Healthy Homes and Patients program is one that we've been working on for a number of years, and it has a dual purpose. One is to identify patients living in unhealthy home environments, but in the process, the other thing we do is we train physicians, young physicians, residents, family medicine residents, pediatric pulmonary fellows, to understand what those problems might be in their homes. What was particularly remarkable was that 80% of them said it changed how they practiced. That is, in the process of seeing firsthand what could be a problem in a home, they now have a better sense for, when they're in clinic, what questions to ask about the home environment.
As a pediatric pulmonology fellow, I take care of a lot of children that have asthma and allergies, and a lot of these children are very symptomatic and spend a lot of time in the hospital suffering with symptoms from these. And with the opportunity to go into the homes and see all the things that are going on in the home, it has provided me with an opportunity to see how interventions can be made to reduce the amount of symptoms they have and to reduce the amount of time they spend in the hospital.
Before the improvements in the home, we were taking them to the emergency room and to their regular physician at least twice a week. It was bad. It was really bad. Now, we honestly haven't had to take the boys to see their regular physician, only on, just well visits. So it's been amazing.
It's been fantastic from my standpoint to be able to participate in such a wonderful program where we can go out, actually see what they're discovering in these homes, the interventions that they're making, and then how it really impacts our families.
The weatherization program has always had an emphasis on health and safety. But what does health really mean, and how do you impact that through a program?
The one evening where my 4-year-old, Marcus, we had tried giving him, his breathing treatments, and it just seemed like nothing was working. And at that moment, I think that was probably the scariest moment, because he looked up at me and, he was gasping, coughing. He was, he was helpless, and I was too. And I think at that moment, I kind of looked at my husband and said that, we can't continue to do this. There's got to be something that we can do to make this better for him, because he's struggling just to breathe.
We became involved in 1990 with the county's Healthy Home Project, the Urban Mold and Moisture Project. And it was really a first. It was the first time we were combining a look at an impact of the health of the resident with the energy conservation services. So we were breaking new ground.
They did such a great job around here. They put faucets in the bathroom and over the tub. They cut out the wall and where there was molding from the water, and they replaced that. And they went all around the house and replaced the plugs around the house. They put rails around the bathtub. And so now when I go in there to take a bath, I'm not afraid to get in the tub to take a bath, because at one time I had slipped in the tub. And on the south side of the house here, water was coming in the basement, and the whole basement were molded. And so that I think had caused me to have a breathing problem, and I didn't realize it. If I had to do this work myself, it would never got done, and I guess I've been 100 years old before it would really come to fruition.
We had the roof replaced, which was a total godsend. We had spots that were missing, it was leaking. We had some mold. The mold removal was probably the biggest problem that we had. The basement was taking on quite a bit of water, and with the moisture that was in the basement, we had the big mold problem. So for us, having them to remove all of the damaged stuff and having the mold removed was probably a lifesaver for the kids.
We want a house that's maintainable for our families and that's affordable, and that means meeting a very high level of energy efficiency.
Affordable Green Housing Center at Environmental Health Watch provides information and technical assistance on healthy and green housing and fosters research and demonstration projects. Our unofficial motto is green housing for people who need it the most. We see that low to moderate income residents are most affected by high utility bills and unhealthy housing. And so we make the point that green housing is not just for high-end projects, but it's really important for everybody.
One of our current projects is the Deep Green and Healthy Home Study Project, where we are studying the energy efficiencies of 12 houses, 6 of which have been done to the Cleveland Green Building standard, 6 of which are being done to an upgraded standard of efficiency and, we hope, indoor air quality. So when we talk about deep energy retrofits or deep energy reductions, what we're doing to those houses is dramatically improving the energy efficiency of those houses, far exceeding levels of code insulation, of air tightness levels, of windows and doors and mechanical systems.
There has been tremendous collaboration across so many different agencies that really will allow us to set the tone for future success. And it really is a great way for us to enhance the services that are basically available to our constituents. It also allows us to gain access to areas of expertise that might fall beyond our scope, and then it allows us to connect our citizens with programming that will help them to improve their health and their housing.
We know that since 2004 through 2010, we've reduced lead poisoning rates by 52% in this county, and we're proud of that. That's a huge step forward, and that's evidence of impact. And that is infectious in a positive way in the community. People want to be part of that.
We've always felt that it's important to both listen to the community and provide leadership. And I think through the council, you pull many people together and can really make sure that the resources that are invested are used in the best way possible.
We've all come together with our departments of development that help us work with housing and understand housing to have what we think has been the most sustained impact on health of just about any other community looking at healthy homes, and we're proud of that.
In our community, what we're attempting to do is to work through congregations, through my capacity as the advocacy director at LMM. It's important to involve communities through churches, establishing what we call faith hubs, to help us get the information out to parents about vital programming to help their children around child lead poisoning and other hazards that impact children in their homes.
Advocacy is very important in this initiative. Advocacy from the standpoint of connecting with our constituents, educating and empowering them about ways that they can protect themselves and their loved ones. But also advocacy plays a very important role as it relates to informing and influencing our stakeholders and those decision makers. Because what we want to do is increase the awareness, and we're fortunate because within the Healthy Homes Advisory Council of Greater Cleveland, we have a number of partnering agencies that conduct advocacy on our behalf.
We go into the heart of the community and we do what we say we're going to do. That's the most important thing, and they are seeing results, and they're very pleased by that.
Conditions in the home affects how the young people grow up to flourish in life. So our concern about their flourishing is so important to us that the conditions in there, the physical conditions in those homes, the emotional conditions in those homes, the stresses that trigger some of these illnesses in the home are very important. So for us, this is something that we take very seriously.
Seeing everyone come together, seeing the perfect alignment of organizations and resources is something that I'm extremely proud to see.
I think it's great that you got that many people in that many organizations that can sit in a room, let alone try to get along with each other. And I think that diversity is what gives it strength, because what we see is solutions coming from different corners of the coalition. And we got the foundations and other organizations that are kind of holding it together as glue. Now we just got to finish the job. And what that's going to take, obviously, is more dollars, more funding, more collaboration, and more effort.
It's very important for health philanthropy to really listen to the community. We're not so arrogant as to believe that we know where all the problems are. And I think we know now as a community that an unhealthy population and certainly an unhealthy workforce is not going to be what builds the future of the economy of Cleveland and other cities in the future.
We know that health and housing speak different languages. We've had to cross that divide, and we've done that successfully. We know that getting multiple sources of funding is essential, federal, local, state resources, in order to have the biggest impact on the community, and we've done that. And we know that strong partners that are committed to the families in this community is essential, and we've clearly demonstrated that. What's concerning us is that as we look at the future and some of the stresses from the recession, is that we're seeing a reduction in some of our federal resources at the same time as we're seeing a national philanthropic movement, foundations all over the country saying we want to put money to support this work on the table. We need the sustained federal effort to support our local resources and the national foundation movement so that we can continue this success. We have traction, and we need that commitment from the federal government.
We believe that the funding partnerships need to remain in place and get even stronger. This is an opportunity for all sectors of the community to come together. We will not be able to fill the gap created by federal funding cuts, Those are areas of advocacy. But by bringing our efforts and bringing our resources together, we will be able to continue to make progress in our community.
So I just want to encourage funders who say, well, we're not a health funder, this isn't our topic, to think a little bit more broadly. You can be a neighborhood funder, you can be an education funder, you can be a family funder, and find a place in this space to work.
There are kids out there and families who are forgotten or ignored or not understood in terms of the scope of their needs. And we have an obligation to try and meet their needs so that everybody has a fair shot at having a bright future.
You know, the shared goal is to have a truly healthy community with a vibrant urban core. And so we see a very bright future for this work.